to anyone who's out there, if you are looking to try to make those aches, the pains, the anxiety, any of that go away, you really need to understand where it's coming from so that you can make changes in your life, or understand that you need to stay doing things in your life and not give up on it for the rest of your life so that they aren't ongoing issues. And functional medicine providers will help you with that.
Hey, everybody, I'm Lori Schulweiss.
And I'm Jen Giammo.
And welcome to another episode of Everybody Talks, the podcast where we explore the wide world of wellness. Sometimes we talk to experts, sometimes we just talk to each other, but we're always talking to you. And don't forget, if you want to watch this episode, go to our YouTube channel at Everybody Talks Podcast.
Every week, we discuss topics from nutrition and exercise to mindfulness and self-care. Today, we're talking about functional medicine with the medical director for the Functional Medicine Center of New Jersey, a Lyme literate doctor, and a member of the International Lyme and Associated Diseases Society. She also holds additional board certifications in pediatrics, neonatal critical care, functional medicine, anti-aging, and precision medicine. She believes in identifying the root cause of a patient's symptoms and treating them holistically with a personalized plan based on their bioindividuality.
With her today is her business partner, also a certified functional medicine practitioner. She shares the same passion for helping patients achieve maximum health through a comprehensive and individualized approach. She holds a doctorate in chiropractic and in natural medicine. Together, they are committed to achieving optimal results for their patients and driven by their genuine care for each individual. Very important. Please welcome Dr. Nicole Anderson and Dr. Kelly Blundy. Welcome, guys. Thanks for coming to Everybody Talks.
Thanks for having us here.
So we usually start by telling us a little bit about yourselves and how you found yourself where you are.
And how you met each other.
Yes.
You want me to go?
You can start.
I do love sharing the story of us because I think we have a pretty awesome story. So it started over a decade ago, and practicing chiropractic at the time. And I was sort of known as the go-to for the MDs. So MDs, especially surgeons that are standing all day long in an operating room, not a comfortable position to chronically be in. So I was sort of the go-to. And I had Dr. Anderson was this busy, incredible neonatologist at the local hospital nearby at Valley, where both of my children were delivered. And what started off as supposed to be a half an hour appointment turned into a 2-hour dive. I'm so sorry about your back, but we have many more things to talk about. And that's where the beginning of our relationship really evolved. And through this process of just trying to navigate our own health, our children came into play. Actually, my daughter, when she was delivered, Dr. Anderson was right there in the room with me. She was the first one to hold my little Emma, who's now a 9-year-old sassy little girl. And that's sort of when I started seeing her own health issues come into play. So, is what we do. We call everyone we know, we brainstorm together, and, through both of our stories that we'll share, we met with some of the same frustrations that a lot of patients face in traditional, conventional medicine. And at this time, I was really, really blown away by functional medicine and what I was learning about it. And that's when I had learned about IFM, the Institute for Functional Medicine, signed up, never looked back. And one night, one of the many nights, sitting at a wonderful bar, sharing a delicious cocktail, as we would do, that's where we started talking about it. I think I went to the bathroom. I came back and
I was like, it's done.
Yeah, Dr. Anderson said,
I had the space kicked out. I was in negotiations 3 days later for this building, which took 8 years to build. But
Wow.
it was one of the, we are both very dedicated to what we're passionate about and make it happen.
Yeah.
And in my journey, we laugh about it all the time because we have basically married each other at this point.
That sounds vaguely familiar.
Totally.
I was working crazy. Yes, I too was up for days on end. I know what it's like to be up for 28 hours straight. It was also training for a marathon and had an injury. And that's one of our friends said, you need to go to Kelly. And the way he described her was not at all what I expected. He told me that she was really tough. Like she's just going to do what she needs to do. And I went to that appointment, made my husband go with me.
You were afraid.
You come in with me. He's like, I'm not going in with you. And walked in thinking she was going to be this very mean, aggressive person. And
Like Olga or something.
Yeah, you said Olga, and that's exactly what I thought of.
was I lay down, and honestly, I feel like 2 hours passed, and my husband was like, "What's going on in there?" And we knocked on the door, and we were like, "No, it's okay, it's okay." And I think we haven't stopped talking since. It just never stopped.
I love that.
Yeah.
During that time, Kelly rebuilt my body. I'd say that she was like my everything. I would run and get there, and she would fix me so I could do what I needed to do. And my last 25 plus years was really focused on neonatal critical care. That was my passion. And in that time, I was blessed with two beautiful daughters who were extremely active. They swam full time, like all year long. And at around fourth grade for each of them, they're about 20 months apart, things started to change. Little things, small things. My one daughter, I found a tick on her. We were down at our beach house. And for the recommendations, I did what was super conservative, which was give her antibiotics for 24 hours, which are still the same recommendations in the Red Book. She had never gotten antibiotics before in her life. She never needed them, and didn't really think much after that tick bite. But she soon after started to develop joint pains, fatigue, racing heart rate, a hand tremor, migraines. And my amazing colleagues were all throwing diagnoses at her and prescriptions. And I kept saying, something's not right. And I kept sending her testing along with her pediatrician, who's in New York, and everything kept coming back negative for Lyme. My other daughter in fourth grade, who's a year behind her, was bit on the playground at school, ended up with weeping lesions down her legs, was hospitalized at a hospital for 5 days, and still they didn't know what was wrong with her. And she too started to develop strange symptoms, recurrent sports injuries. They were tearing their rotator cuff. They were getting Achilles tendonitis, patella tendonitis. Kept taking them to Kelly. I kept saying to her, like, who goes to a chiropractor? Great, right? You're like, what's happening? And it took about 10 years to figure it out. And during this time, I wouldn't say I was necessarily frustrated with my colleagues. I was so grateful that my colleagues were opening their doors to help us, but nobody was giving us or helping me find out what was really wrong. I was getting a million diagnoses, and it just didn't sit right. And as a neonatologist, we are a little bit different than everybody else. We don't necessarily give diagnoses. We look at the whole baby. We try to nurture them, to grow them. And it just seemed like something was missing. And at this dinner, or actually cocktails that night, we made a commitment to really trying to figure out what the root cause was with my daughters and with her daughter. And we threw ourselves into functional medicine. And that's how we both ended up here. We thank our daughters. We tell them this place was built for them in their memory. Their journeys were not in vain, right? And this is a testament to what we've learned from our own children.
Wow. So looking back, why do you think that the Lyme kept coming back negative?
So I now know. I was not taught this in medical school, nor was I taught it in residency or fellowship or elsewhere. In the regular test that we send out to our standard labs only looks for one strain of Lyme. We call it Lyme, but it's Borrelia burgdorferi. It looks for Borrelia burgdorferi sensu lato. There are over 30, 40 strains of Borrelia burgdorferi, right? And it's only checking for one. So I explain it to people that it's like all the pens on my desk are all different colors. And if I'm looking to diagnose a pen and the diagnosis only tests for a red pen and you have a green pen, you're going to be testing negative. And I sent that test 4 times. I never knew that, right? And I was trained at a very good institution. I am diligent about what I know. I read for my own children, and that information didn't become available to me for a very long time. The other thing that was involved was that my children's pediatrician who trained me at Columbia was in New York. So in New York, you cannot send out the specialty labs, these things. So that delayed diagnoses for a very long time. But I like I said, I'm grateful that I went on this journey. My children are well. They are completely dedicated to this cause and are aware that we have learned so much and have educated my colleagues and congressmen and representatives. 2 weeks ago, my daughter was involved in fly-in where nationwide, people reached out to really educate our legislative branch about
That's awesome.
the importance of
Wow.
And now all of our listeners
I know,
on Everybody
everybody
Talks.
here.
Kelly, your daughter had a similar experience?
So my daughter, it was so crazy. Like I will say the second time around with a kid, I think I'm like most mothers, you're a little bit more relaxed. You kind of know what to expect. I wasn't as intimidated by breastfeeding and staying up late at night. I was like ready to go. I'm like, I got this. I'm totally good. Did not feel that way with the first kid, but you live and you learn. I started noticing that she was getting colicky, like colicky beyond normal, right? And going to the bathroom, I could tell she was in pain when she was doing it. So of course, first thing is like, well, what am I eating? What am I eating? Don't eat onions. Don't look at an onion. I don't look at anything, right? I'm like, I'm at a point now where I feel like I'm just eating air, and she's still having this reaction. Fast forward, find out she's allergic to my breast milk. I'm like,
Oh,
what?
God.
Right?
Oh my
So
God.
of course, went to all these different pediatric gastroenterologists, spent a fortune getting, I don't even remember what the formula was at the time, but it was double the price and teeny tiny little can. And she's doing okay. Now she's off of milk. Now she's eating solids. She's probably 15, 16 months old. And going number 2 was like torture for her. She's in pain. She was developing something called encoparesis. So basically, she has hard stool like clay and then diarrhea going around it. It was just awful for her. And I waited a really long time to go to another pediatric cardiologist. And it was interesting. I was actually gastroenterologist. Sorry. And I remember I was away. So of course, husband, please go. Please, here's the list of questions. Here's everything you're supposed to do. And I said, so how did it go? He goes, well, the doctor said, food does nothing. Diet changing does nothing.
What?
And wait, it gets better. You need to get your daughter a psychiatrist because and she's
How old?
15, 16 months old, right?
Okay.
Because she's going to be so traumatized, truthfully, from going number 2.
She'll never want to go.
That was the advice I was given. So
Wow.
now, thank God, I was going through functional medicine, and Dr. Anderson is, thank God, my go-to. If I had a dime for every time I send her to the house to look at something, I'm so very grateful for that. But I said, to my husband, I am spending a lot of money and time trying to get this new certification and learning, and we need to start applying it. And I would tell you within 3 weeks of focusing on foods and focusing on diet and cleaning up her gut, probably 75% of her symptoms were gone.
Wow.
You would not, and I truly say to this day, I do not think, because my daughter ended up needing to go in early intervention and a lot of things, because we know the gut-brain connection. We know that it affects them neurologically. And I started seeing things like really head in the wrong direction. And I'm so grateful for the education I got and really jumping on it. Today, you wouldn't have known. She totally took a turn. And I don't know if I could say that if it wasn't for the background
Sure.
that I was learning.
Yeah.
It's amazing to me that a gastroenterologist could actually say food does
Like
nothing.
that's your whole deal,
So
right?
this is what you do.
Yeah.
I mean,
It's scary because they're still saying,
Yeah.
not all, but some
Yeah.
are.
yeah.
Yeah.
I want to talk about, functional medicine and integrative medicine, because for a lot of people, and probably people listening, even though we have explored this topic a lot on this podcast,
We really have.
it's still, there's still a lot of skeptics out there. Talk to us about like some of the misconceptions around functional medicine.
So one of the things I don't like labels, and I say that to Kelly all the time. I'm like, I think we're a little bit of everything, right? I'm an MD. I'm a functional medicine doctor. I'm integrative, right? I do a little bit of everything. But I think what people have to understand is that we're not denying that people don't have symptoms. When you go to med school now, they basically say to you, here's a constellation. They teach you anatomy, physiology, and pathophysiology. And then they give you a constellation of symptoms that you pair up with a diagnosis, that you pair up with a pill or a surgery. And that's the reality of training that I had. I'm blessed at where I was trained. There's some little bit nuances that were different, but that's the way that you're trained. And I'm not faulting my colleagues for approaching pathology that way. That's the way that they were trained to do so. I think the education needs to be changed. But what we do when it comes to functional medicine, if you want to call it that, is we step back and we say, okay, you have a symptom, which is your body screaming out that something's not right. And you can have a constellation of symptoms that you could write down. That could be anything. I could give you the diagnosis of anxiety. I could give you the diagnosis of Lyme disease. I could give you the diagnosis of gut dysbiosis. You could give anything. That doesn't matter. What we try to do is back up and try to find the root cause. What's causing it? Most of the time, we have to start at the gut. But what Kelly and I want to do is see how the genetics behind someone, right? What are their predisposing issues? What are mediators? What the way they're living their life, right? What are they eating, drinking, breathing? How are they sleeping? Stress management? All these things, which, like I said, is very much part of neonatology. And look at the triggers, things that are happening that are turning these things on. Ultimately, that's what functional medicine is. It's trying to understand what your genetic predisposition is, how you're living your life, how that's influencing it, and what really happened to cause these symptoms. Not give it a diagnosis, but what happened and how we undo that. Because if we take that thing away, whether it's toxicity or Lyme or food issues, whatever we're talking about, like with Emma, with food allergens, then things get better. I could give Emma 900 diagnoses for what she presented with. It doesn't matter. It doesn't matter. Ultimately, taking away the root cause is what changes. So that's what functional medicine is. It can be applied to any subspecialty, whether it's, GI, cardiology, whatever. It doesn't matter. But that's what functional medicine is.
If I can add my 2 cents, I think that when we look at this country, and obviously it's screaming for help when it comes to health, is that what I think the current conventional model is really good at is emergent care, right? If I have a heart attack or I get impaled with an object, I'm so grateful to the ER doctors and the surgeons that are there to take that emergency situation and save a life. Chronic diseases, we're plummeting off a cliff. And that's because it's more sick care. All of these things that we're doing are getting us, unfortunately, to this point. And where functional medicine differs, along with what Dr. Nicole said, is that we're trying to, if you're healthy, keep you healthy from the start. It's about prevention. I don't like the word anti-aging. I like aging well.
Yes.
I want to.
We like that too.
Yeah.
No one's against aging.
No.
Yeah. I love analogies. I'm like the queen of it. And I say, the last thing we want to do is sit in a poison ivy bush and have somebody hand you the cream. Because I don't care how much cream they give you, you are still getting a rash. So again, taking a step back and looking at the entire person, the whole person. We do need to stop dissecting ourselves because it's all connected at the end of the day, and just really empowering people to take control of their health, because you should be doing it with energy, love, happiness, stamina, and good sleep, great sex, and all that goes with it, right?
Yeah.
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 I mean, yeah, I don't understand why. Look, I've learned so much we've been doing this podcast a year and a half or so, probably 2 years by the time this airs. But yeah, I never knew that root cause existed, like that kind of thing existed. Because I'm at the tail end of a generation that listens to everything that a doctor,
doctor
says.
says.
And if the doctor tells you something, I mean, I've told this story about my allergies ad nauseum on this podcast, but I feel like I finally found a doctor who I was having all these things. I developed eczema. I had bad allergies. My eyes were puffing up. I mean, she would witness 1 minute I'm fine. The next minute I can't open my eyes. Like I could not, I went to 4 different doctors.
Yeah.
And finally went to this one woman who sat down and we talked for 15 minutes just about my eyes, forget the other things that were going on. And she was like, I think this is going to help you, but if it doesn't, I have other things. We're going to fix you. And that is really all people want. And they'll do whatever it takes. I will do, if she said you need to eat eggplants every day to fix this, I would, because that's how miserable I have been. But I don't understand why more people aren't like that. I like what you were saying. It's really about keeping you
I mean,
well.
keep those in practitioners.
Yeah, like seeking out, and why there aren't more functional, why it's so hard to find one.
Right.
A, and B, why don't people seek them out more? Like we're just so complacent about going to the doctor.
Yeah,
When we're sick, going to the doctor when we're sick.
We've got a lot of people seeking us out.
Yeah.
Yes,
Oh, yeah.
they do. They have a lot of people.
Yeah.
There's a paucity of functional medicine.
Yeah.
And
Yeah.
and I think there has been, like you said, a misconception about what functional medicine is and who we are. And that is changing, definitely changing.
I think too, unfortunately, to tackle that question, why, this podcast would have to go completely.
I know.
You have to talk about, insurance companies and
Yes,
pharmaceutical
yes,
companies,
yes.
because unfortunately, when I look back and I look at my studies, and I'm sure you'd say the same way, yes, some things are complicated, but not a lot of things are not. And we tend to feel that we have to overcomplicate things and they have to cost so much money. It has to be this. And I remember prior to probably about 10 years ago, I was like, it's not that complicated. Why are we making this so hard? Then you dive into the politics of it and you're like, oh, that makes sense.
Yeah, that makes sense.
So, but I just love that people, I really think the country is waking up and they're really
that's
asking
true.
the right questions and demanding better answers and better care.
Yeah, I
Yeah,
think you're right.
definitely.
I think especially generationally, I think that younger people are recognizing this more. Obviously, we are, not that we're younger,
know,
but like just
yeah.
from being more exposed to this and talking to more doctors. And, we're fortunate enough that this is the kind of podcast that we do. We're not talking, to me, that the compartmentalizing of healthcare is so, it's just such
A lot of specialists.
oh my gosh, it's like no one's looking at the whole person. No one is, you guys are, and functional practitioners are, and integrative medicine is, but it's very frustrating when you have a parent, let's say, maybe mine, I don't know,
Yeah.
who is so old school in their thinking.
Yeah.
It's like the doctor, I looked at the list of medications that my dad is taking, and it's like, this is insane.
Yeah.
How are you taking, like, what are these doing? When was the last time they were, evaluated? I don't know. Whatever the doctor tells me to take, I'll take it.
And I have
Like,
to ask, what's his, is he feeling better? Is his quality of life improving?
Exactly.
No,
Yeah.
he's
No,
tired all the time. He sleeps
Yeah.
all the time.
Yeah.
I tell my patients, I'm like, if I could eat whatever the heck I wanted to eat, drink whatever I want to drink, and I could take a pill and that would neutralize everything and I would feel great, sign me
Right.
Yeah.
up.
Exactly.
It doesn't work
But,
that way.
if you look at the food system and the processed foods and the amount of pharmaceuticals that are elevating, you should see diseases go down, but you're not. You're seeing it rise. And that's where everyone needs to take a pause and go, okay, the definition of insanity is doing the same thing over and over again, expecting a different outcome. You need to change the narrative.
And I believe also, and again, I'm praying that the educational system changes. But there was a shift along the way of the involvement of pharmaceutical companies partaking in our education. So there was a time, most of my training time, where every day there was somebody standing there buying us lunch, handing us brochures. This new pill is the best one. And you were just like, okay, they would show you the studies. You'd be like, okay, I have this patient. That's the new pill I'm going to use. And that's still going on, not necessarily in residencies and fellowships. It's pulled back a little bit, but it's still happening every day in the doctor's offices. The way that care is structured is that it is almost like a mill. Patients are going through and going through, and you're have to see a gross number of patients in order to be able to keep an office open. And that puts a strain on the doctor's time in order to go out and educate themselves. So they're relying on these people who come in to tell them the best new thing without having the time to educate themselves on other ways to do it.
Yeah, because it's easier to just,
That's
you
the
know,
cheat.
yeah. But I do hope it's changing. And I do think, I mean, just seeing, so Lori, I don't know if you know, I actually visited the Functional Medicine Center of New
told
Jersey.
me.
The things that they're doing, I feel like that needs to happen
Yeah.
everywhere. Like I want to get into the treatments and things, but just for a second, go back. I just want to go
up a bit,
through
yeah.
the process of, take us through when a patient comes in to see you. What
Like,
is
why
that?
does someone come
Why
see
would
you?
someone come in, and what does that look like? I know you said prevention is a lot of it, but you know,
But a lot of it, I would think people end up at your door because they are suffering from something rather
It's
than
for every
prevention.
reason you could list. There's
Yeah.
not one single thing they come for. They come for everything. I couldn't even tell you if you said, who do you take care of when you take care of everyone is a bio individual, right? They have their own issues, they have their own exposures, they have their own, genetic predispositions. So we don't take care of just one thing. We take care of people with different concerns, different issues. We never know who's going to sit down in front of us. And Kelly will tell you a little bit about the process of how that happens.
Yeah, I would say most people are suffering from something. And the common trend I get is, I've been to a plethora of people with no answers. That's the biggest one. I'm not getting heard. Or the this one told me not to see this one. And that's one of the things I want to say, within functional medicine, regardless of where you started your education, or whether you're an MD, a DO, a chiropractor, a naturopathic doctor, we are meant to work together as a team. And instead of separating, right? We did that with the body, not working, right? We need to come together because we work better as a team. I want to hear from anybody of, seeing it from a different lens or a different angle and then coming together. That's how we truly help people. But coming in the office, did you guys want me to take you through the process?
yeah, I want to know, like, what types of testing do you do? And I know there's obviously different situations and different scenarios for different people, but generally, how do you identify? What's the testing process look like?
Why don't you even start with the concept of the discovery call, which is
Yeah.
very different than when you call a doctor's office and ask for an appointment.
So one of the things that, we talk about the pillars a lot, right? And it's not just about nutrition and sleep and movement and stress, but it's about community. So the first step is aligning yourself with a community of people who really care. When someone calls the office, we don't want to have your typical where there's somebody sitting up at the front on the phone for a long period of time. They go on, hopefully check out our website, and they book what's called a discovery call. And that's where they get to meet Jules. Jules is I've known her a really long time, breath of fresh air. And she's just somebody that you can sort of say a bunch of things to, and she could just regurgitate it. You know those people, and they're like, oh my God, that's exactly what I was thinking. So, and that's a time for she spends anywhere between an hour to 2 hours with a patient on the phone. Sometimes 3, yeah.
Wow.
To say, one, what's your story? And 2, we want to make sure we're the right place for you. And then every patient gets scheduled for a 2-part visit. And that 2-part visit can be, is 2 different times that they're coming in. The initial, we want to hear your story. I want to leave no stone unturned. And this is where we're at the process of ordering lab work. And that is could be a combination of all of the above, some of the above. Again, it's personalized. There's no cookie cutter way of doing it. So lab work. And I want to just highlight lab work for 1 second. I'm never, and I think I speak for Dr. Anderson and I, never looking at one biomarker individually. You got to look at it, how it looks together. Again, how in a whole body, how somebody's metabolic system is working. You can't tell that by one number. Sometimes you're looking at ratios and how one thing is speaking to another. And then depending on what the patient's symptoms are, stool tests, saliva tests, urine tests. I mean, genetic testing. Yep. Genetic testing is really important. So, and then we're taking their story and we're taking these tests, and then we sit down with them for the second part. And not only are we effectively communicating in a way that the patients can understand, because that's also really important, because there's a huge educational component to it. But we're coming up with a plan for this patient. And that plan is a multitude of things and a team of people, right? And that's
And yeah, I think so as Kelly was alluding to, when the patients come in and they meet with us, they have already filled out an extensive amount of paperwork that really is healing often before people even walk in the door. It gives them profound insight as to what's going on in their own mind, bodies, spirits, relationships. It's very extensive. And we spend a lot of time reading all of that. It goes through everything, every symptom they could have, everything they've ever done in their lives, what they're eating. And it takes patients a lot of time to do that. And I'm always grateful they do that. But when they come in and I thank them for that, I turn those papers over and I tell them, I don't want any preconceived notions. I just want them to tell me their story. And I lay out a timeline about 5 or 6 and sometimes 10 pages. And I say, start wherever you want. And those appointments can go on for 3 hours. I've had them go on for 5 hours, right? Like, everyone has a journey, and understanding sometimes their own journey as they unfold it and they see it in front of them is so profoundly healing. They'll tell me their story and I'll look and circle and be like, what happened here? And they'll look, I had somebody look at me and say, my brother died unexpectedly in a car accident. Oh my God. Like, it's that in and of itself. You're like, okay, we got a aha moment. And we do that. They have their exam, they have their in-body scan, which lets us know what their body's made out of, not what their weight or their BMI is. They get whatever testing we need. And then we give them some recommendations while they're waiting for the testing. I can't tell you the number of times I have patients come back to sit with me for their second day visit and say, I feel so much better already. There is a very cathartic thing about telling your story. It is empowering for them to see those things as it's laid out in front of them. And they're like, yeah, like, I get it. Right. And then when they come back and we share even everything else we find, it's incredible. And we spend a tremendous amount of time trying to teach them about their bodies, understanding their bodies better than anybody else. I say to them, the best thing I can do is get you to understand your body better so you can go out and advocate for yourself. It's not my job to do that. I want you to know how to do that.
What an amazing and unique experience that these patients are able to get when they come to see you. I mean, you don't hear of any doctor spending more than 15 minutes with you, never mind 3 or 4 hours. I think that's so important. And which is why patients probably feel, I already feel better because someone just listened to me and they're taking in the whole picture. I think that I just got like chills. I think that is huge, I mean, that's amazing. All right, we want to get into like some of the modalities and stuff too, because we have questions about so Lori and I about a year ago went to a biohacking conference where we got to test out and try
a lot of things. Have to do with, I mean, the biohacking conference, I think, is about longevity as well, more about longevity and making your life and living
totally
better,
is, absolutely.
living better rather than functional medicines. Although there was plenty there, I think, that of things that you offer, but but one thing that does well, we can get into this after you talk about the things. But yes, why don't you talk about the different modalities and if they really help? A lot of it sounds like hocus pocus and science fiction, but it's not. And I know that it's not, and a lot of people know that it's not, but not enough people know that it's not.
I'm a science geek.
Yeah.
A lot of, well, I say not all of the modalities we have here were used on healing our children. I am certified in so many things because along my children's journey, I needed to understand everything very deeply. I needed to understand why we were doing things, how things worked. And I approached these modalities the same way. I needed to understand the science behind it. A lot of it, I was looking at the science behind how it interacts with infections, the immune system, rebuilding the gut, other things. And Kelly and I were really adamant about understanding things and being certified in things before we would even offer it to our patients. So we come at it very different than a lot of the biohackers. We use these things that we understand the science behind it, and we understand the biochemistry, how it interacts with the cells, and in infections and other things, to use it, which is very different. And we don't let everybody have everything. We are very strict. If a patient needs it, we use it in a responsible way so we don't create more oxidative stress or injury.
A lot of these modalities that we use, they have really cool, I will say I've seen some home devices and things but to Dr. Anderson's point, just because something works right in someone's body at that moment in time doesn't mean it's going to work in everybody's body, right? So if I am, let's say, using a red light mat, right? And I've got two people in front of me that are both inflamed. And I have one patient that eating the standard American diet and drinking soda. And I've got one person eating organic and drinking water. Their body is going to respond differently. Does that mean the red light therapy didn't work? No. What that means is that there are more factors. It's not a do whatever you want. And we're not here to say, okay, don't do that drug, use this nutraceutical. We're saying there's things you have to remove triggers. You have to put the right things in your body, and then these things can work better for you, right? So I personalization is key.
Yeah, definitely.
And yeah, you need to be doing those other
Right.
things that are going to
Right.
support, what you're trying to fix, lack of a better word.
We have a lot of patients who come in that are like obsessed with biohacking and
Yeah.
will come and be like, I just want to do everything. And
Yeah.
we can't. And
Can't.
that's this thing. I'm not like negating that there is such incredible stuff. I love these biohacking conferences. It's like so exciting for me.
Fun.
But what I hope that I can get out there and Kelly can get out there to our colleagues who are using these, to our patients, to the community is, they can be powerful in helping you, but also they can cause damage. And I think that's where understanding the science behind it is so important, and understanding what's happening in someone's body when you use it is important.
That's interesting. Talk to us a little bit more about that, because I'm just thinking about, when we went and I mean, there are certain things that I won't try because and I think we talked about this, I'm very claustrophobic. I won't do the H-bot. But I remember someone saying to us, and I don't remember who this was, if he was the doctor or he was just, one of the biohackers at the conference, that like, oh, well, it doesn't matter. It's not going to hurt you. Like you could, I said, well, what is the benefit of this? And they're like, well, it doesn't, if it doesn't, it's either not going to do anything or it's going to help. Right. But you have a different view of that. Talk to us about that.
So a lot of, depending on what you're talking about, a lot of the way that a lot of modalities work is by creating oxidative stress in your body. When you create some oxidative stress, whether it's from taking vitamins, getting IV vitamin C, using hyperbaric oxygen, using certain infrared sauna, frequencies, pulsed electronic magnetic frequencies, all of these things induce oxidative stress in your body. And when you do that, it can be profoundly healing because you get upregulation of your antioxidants. You start stimulating production and release of your stem cells. You get upregulation of your growth hormones like BDNF for your brain and other growth factors that are important. So that's where kind of this whole idea of biohacking and anti-aging feeds in. But understand, and I'm going to use I hate to keep going back lactose. I hope that, everyone doesn't mind, but I'm going to go back to the concept of Lyme. If you are a patient who has Lyme disease and you have a lot of oxidative stress in your body, right? Because you have these infections and a lot of inflammation. And I use these modalities to create more oxidative stress above and beyond what your body can handle, because we have all these mechanisms which quench that stress and that extra inflammation. You're going to get sicker, right? You're going to feel worse. It's going to cause more damage. It's going to influence your immune system. It's going to cause you to have more inflammation in your brain and in other tissues. So that's an example. Or another example is if you have a profound amount of toxins in your body. If I get you into lymphatic massage and I start pulling these toxins more than your body can detoxify them, you're going to get sick, right? They're stored there. But if I start pulling them out, you're going to get sick on me. So that's where Kelly and I differ, I think, from a lot of people. I have people that come in and say, oh, there's this new place that opened in the strip mall. And I went in and I did cold plunge. And then I got into hyperbaric. And then I did this and I did that. And I feel terrible. I feel awful. And I'm like, of course you do.
Yeah.
Of course you just basically blasted your body with more stress than you can handle.
Right.
That stress is incredible, right? That's like a little bit. That's what all that stuff does. A little bit of stress upregulates all those things we talked about. But too much, no good.
Right. So sometimes, and Nicole has taught me this, sometimes we have to build somebody up before we can use these modalities.
Sure.
And that's, again, where the personalizations, we are not just, hey, come on in, free for all. We are looking at a timeline of healing too, not just their own timeline, but when is it appropriate and right to start adding something else?
Right.
Yeah.
So then would you start with, what would you start with? Like, let's, again, just take Lyme for an example. What would you start with that person? Would it be nutrition? Would it be, what is that?
So it really depends on what's going on. But if I have somebody that comes in that is profoundly exhausted, who cannot even get up out of bed, who I know when I go back to a cellular level and I start thinking about the cell, their mitochondria are shut down. They are not making ATP. I have to sit there and say, okay, let's go back to the basis of like how we survive and how a cell survives. And I often, not always, will say, okay, let's get in the hyperbaric oxygen chamber. Because if I can get oxygen into a body and into cells where there's inflammation, I can start to create energy. And if I can create energy, then I can start then building out and start then fixing the nutritional deficiencies, fixing the membranes. And I work from the inside of the cell out, quieting the inflammation. There may be months before I can start treating some of these patients aggressively for Lyme because their bodies are so broken down. And I bow to my older daughter for teaching me this. I always say my younger daughter taught me about root cause. My older daughter taught me about bioindividuality. My younger daughter took me 10 years to get a diagnosis and figure it out. But in that time, I built her body up. She was ready. There was a permissive healing environment for me to treat her. My other daughter, she was a vegetarian. She had methylation problems. She had all this inflammation. There was so much going on. And I threw treatments at her and she wasn't ready. And she taught me that. So if you start, and if all of my colleagues went back there too and go back to cell biology and slowly work your way out, the body is really strong and powerful. It starts healing itself. I feel like I could heal so many people with just oxygen and food. Seriously.
Okay.
You heal the gut, you go after, start healing the gut, you get the body to absorb nutrients again. Or if we have to do IV, we get it in what they need. We give them oxygen. We start making energy, and the body can start healing itself again.
Can you
really
just
profound.
explain what a hyperbaric chamber, what that does? Like when you go in. I mean, I know I'm not even claustrophobic, but I didn't want to get in either.
Well, I always say we breathe in, not breathe out. We breathe out for other reasons, to get rid of toxins and to stimulate our vagus nerve and do all those things. But we breathe in to get oxygen into our body. We breathe it into our lungs. It goes to the alveoli. It crosses over from the air sacs into capillaries. And that oxygen gets taken to cells all over the body, right? And when it gets into the cell, the reason oxygen gets there is because it has to get into what we call the mitochondria, where you make energy. the electron transport chain to make oxygen. The rate limiting step when you and I are breathing now is how much oxygen, when we breathe oxygen, it is the amount of red blood cells we have, the hemoglobin. And we can carry oxygen, sticks to the hemoglobin, and we carry it around our body to our cells and unload it. When I do your pulse ox and put that little thing on, maybe it's 98, 99%. That means 98 to 99% of those spots are occupied by oxygen. There's maybe 2%, which isn't a lot, right? So if I give you oxygen, just regular oxygen, maybe can get you up to 100%. That means all of those spaces have oxygen on them to get to tissues. What hyperbaric does is really cool. You breathe in, you're in the chamber, right? Which is you get put under pressure, and we determine based on whatever your needs are, and we'll talk about that in a minute, you get put under pressure and you're breathing 100% oxygen. Think of a regular water bottle and a bottle of seltzer, right? You have water, right? And in regular water, there's water, but in seltzer, you take gas, oxygen, in this case, when it comes to the chamber, and push it into liquid under pressure. So what we're able to do is supersaturate not only the red blood cells, right, which is the hemoglobin, but also the fluid, the plasma that carries the oxygen to it. So we can get 1,000 times more oxygen in your body. The other thing is it's under tension. It's got a higher partial pressure. So if you have inflammation, it's able to cross through that inflammation better and get to the cells to make energy. Does that make sense?
Yes, definitely.
And then when you get out, as you come now outside of pressure, it's like cracking the top of a seltzer. All that air can diffuse further in your tissues to even get to more cells to make more energy. Does that make sense?
Yeah. So when you first come out, you must feel fantastic. You must feel like you can.
Some people feel a little sleepy and tired because it's a great calming environment when you're in there. And you actually go from sympathetic tone to parasympathetic tone under that, in that pressure. But so you're nice and calm. But yeah, people feel good, and it lasts for a couple of days. But it's there's different protocols, and it's also one of those things. Higher pressures aren't always better. The lower pressures are better for the brain. The higher pressures create more oxidative stress. So that's another thing I struggle all the time with patients being like, "But doc, I want to go higher. I want to go higher." I'm like, "No, you don't get higher."
Yeah.
You also were talking about, and this is a little going off topic to it, but to a different modality. You said you have PMF at your, and I know that works. I've experienced that working, but I still don't understand why that works.
So can I run with this?
Run away.
I was very skeptical, and I'm still trying to understand quantum medicine, right? I'm trying to understand it. And if you go back to the cell, membranes things that cross over membranes are determined by potentials and by electrical frequencies and everything. So, and the way that cells communicate are the same thing, right? So I'm still trying to tease out that whole component about how different things work with different cells. And I think we're all learning from there's different devices. For us, one of the biggest things for PMF, why we paired it with what we did, and as I'll tell you about this one study, which I think is really cool, but we use it a lot for inflammation, and we use it a lot when we do lymphatic massage. So rather than hire a lymphatic massage therapist, we invested in the only FDA-approved full-body lymphatic massage suit so that we could actually do full medical grade lymphatic massage on our patients. And we do that on the PMF bed. When within our lymph fluid, we store toxins, right? When you get a cold, you get swollen lymph nodes. And we move, I say not for vanity, but we move to detoxify, right? You don't have any muscles in the walls of these lymph vessels that run all along your body. You depend on your muscles to contract, to move that fluid from your feet, up your legs, up to your chest, to dump it into the blood. So you can get rid of all these toxins. So when I have somebody who's trying to detoxify for whatever reason, whether it's that they have Lyme and I've been treating them and they've got all these toxins from that, or they have metal toxins or mycotoxins, we have them get on do the lymphatic massage. But think about it. I'm immobilizing all these toxins, and I got to get them out of the body. And when you start immobilizing these toxins, you start having an inflammatory response. So you have an increase in cytokine production. We all know about cytokine storm from COVID. And that creates more inflammation. So we do it on a PMF bed because of these studies I read, which were really cool. They had patients lie on PMF beds and they put IVs in them and they did serial blood draws. And the longer they laid on the PMF beds, their cytokine levels came down. TNF alpha, interleukin 6, interleukin beta, right? Really cool. And the other thing it did is that it upregulated an inhibitor of NF kappa beta, which is one of the first things that start the inflammatory cycle, which to me, I was like, oh my God, right? I got excited. So I was like, when I get these patients on here, we got to use this. And then we got to get them into the infrared sauna on a detox to be able to move the toxins out. So we pair the lymphatic massage on PMF with infrared sauna to try to move these things, but try not to cause damage. Does that make sense?
Yeah.
So,
Wow.
that, yeah.
We just thought we felt really good.
I just felt really good afterwards.
We touched on a couple of the modalities, neurofeedback, because I'm a big proponent of that.
She really benefited from that for sure.
Love it.
Yeah.
Talk to us about how that works and what types of conditions do you treat with that?
Yeah. You want me to run with this one? All right. So I the way I like to look at neurofeedback is we're looking at how the brain is firing. When we get an EKG, we're looking at how the heart is firing. The brain has a lot more brain waves, a lot more areas. And with the brain, it is supposed to be having these different wavelengths go at different times depending on activity, right? So if I'm awake, I have different brain waves firing. If I'm asleep, I have different brain waves firing. And I have different sections of the brain, the prefrontal cortex and, all the different areas of the brain that are supposed to be firing. So it gets complicated depending on if your eyes are open, if your eyes are closed. We find a number of conditions, whether it's traumatic brain injury, concussion, stroke, down to these chronic diseases such as Lyme or mycotoxins that cause inflammation of the brain, and it's going to shift the way the brain fires, right? So the first thing is let's get a reading. Let's get a reading of what is going on in your brain. And the neurofeedback programs, when you have all these sensors on your head and you're starting to do them, are trying to take the areas of imbalance or dysfunction or firing when they're supposed to or not supposed to be firing. And we put together these programs with the device to be able to refire those brain waves to be working the way they should. And again, I'm trying to layman's terms.
Yeah,
No, you're doing great.
Yeah.
You're doing great.
It's almost like a workout for your brain, right?
Yeah.
We go to physical therapy when we're, rehabbing a body part. Well, we got to rehab this noggin we have here because it's communicating with the rest of our body. So, even down to anxiety and depression and so many, the mood disorders are very near and dear to my heart because I am a genetic mess when it comes to that. And I am so thankful for what I have learned and what I'm able to do and truly be able to help use that modality to help with a lot of those mood disorders as well.
Yeah.
So one of the things, can I just jump in quick?
Yeah, please.
Like he saw. So neurofeedback's really cool because we are hedonistic. We're hedonistic. We love reward. We love it. Like everything is dopamine. Like, oh God, of course, if you're going to reward me, I'll do anything, right? Our brains are the same way. So if you have someone, for instance, I'm going to use my daughter. I hope my daughters do not mind me using them, but my older daughter, I feel like brain fog. We put the neurofeedback on her. And you have different waves, right? You have beta waves, which are your alert, and you have alpha where you're calm, and you have theta right before you go to sleep. And then you've got big old sleepy deltas, which are where you're like out, right? You're asleep. We put the neurofeedback, we put it on the QEEG on her. She had delta waves everywhere. And I looked at her, I was like, how are you even functioning? Like your brain is asleep.
Wow.
It's asleep.
It's so much inflammation from the Lyme and from
shut it down.
That was like, oh my God, right? And I had to get her in the chamber. I had to do all these things. We had to get her, but for instance, a case like that, or maybe someone that has ADHD, they don't have as much, it depends on if they have hyperactivity or not. They may have too much beta, so they're too hyperactive in the frontal lobe. I want to quiet things down. So what we do is we identify those areas, right? If her brain's too sleepy or this other person's brain is too firing in that area, we quiet those areas down. We say, okay, this is what we're going to reward you for. If for her, I'm like, if you get more, alpha activity here, you're going to get a ding, a reward, a sound, a vision, you're going to catch a fish, right? You could be watching a movie and just have this sound in the background. And every time that area gets an alpha wave, because I want it to have an alpha, not a delta, there's a ding and her brain's like, oh, I did it. And it wants to keep getting that reward because we're hedonistic. So you don't have to actively train. Your brain wants to keep doing it to get rewarded. And you start training it to have more alpha and less delta. Does that make sense?
Yeah, definitely.
So you could be watching a movie
Yeah.
and it's just happening and they don't even realize it.
Right. Yeah, I like that explanation because I'm thinking like for me, I was doing it for anxiety, like panic attacks and anxiety. And so I had no delta. I was all firing all the time, So that's interesting that, that explains why you do, what you do with that.
And why it works.
Why it works.
Right.
You want to be rewarded. We do. We want to be rewarded.
What advice would you give to someone who doesn't really know that functional medicine exists or is just kind of hearing about it a little bit, or it seems like overwhelming to even start? Like, is there advice that you would give someone? Where should they start?
Well, I'm going to go with my 4 musts. I tell every patient this. I say, look, there's 4 things that we have to start doing on a regular basis. And these 4 things on a regular basis is how we brush our teeth. Our teeth get dirty every day. You got to brush them every day. Okay. And these 4 things are this. You got to have good gut health. If you have constipation is not normal, diarrhea is not normal, bloating is not normal, right? So we have to stop equating prevalency to normalcy. It needs to stop, right? That's your body going, I don't like what you are doing. So good gut health, because we can probably trace most, if not many chronic diseases back to a dysfunctional gut. Second thing is stop chronically spiking your sugar. So whether that's eating really ultra-processed foods, stressing, not sleeping, working out the right or wrong way. Well, you want to work out the right way, not the wrong way. Those, you don't want to chronically keep spiking your sugar because ultimately it's going to be one of the many triggers that causes your immune system to overreact, right? Autoimmunity is I say it's the 3-year-old throwing a tantrum on the floor, right? You're constantly doing these things that are creating this system to be overreactive. Third thing, correct your nutrient deficiencies, okay? You got to put gas in the tank. All right. If the car is not empty, you don't get a new car. You fill it back up with gas. You don't change the tires. You fill it up with gas. And last but not least, especially living in the Northeast where we're at, or the country in general, is you need to make sure that the organs and systems that are responsible for detoxification are working really, really well. Those 4 things are absolutely necessary. And if anybody listening, if you just start with those 4 things alone, you will profoundly you should see a change in your health. I mean, there's more to it, but those are the basics. Because again, whether we're putting you in a hyperbaric chamber or giving you an IV or telling you to take a nutraceutical, if those foundations are not met, you're not going to see a true change towards health. So.
And again, we go back to the whole idea that we have symptoms because something's wrong. I have patients come in and literally will spend an hour out of the time, and I'm like going through it, trying to like explain their symptoms that they're really not a problem. And I keep saying, no. I just want to know, do you or don't you? Like, I'm rereading what you wrote. Tell me about this. And they're like, well, it's really, really just, I'm like, no explanations. No, people want to explain away your body's call for help. And if your body is in pain, if your body is inflamed, if your gut's inflamed, if something isn't sitting right, that's why you have to be here, right? We're not going to give you a diagnosis and a pill. We're going to say to you, this is what's causing it. Take it away, fix it, learn to live your life, right? Come in here and learn about your predispositions. Your family history is not, your path to the future, right? You can turn that on or turn that off. So I think to anyone who's out there, if you are looking to try to make those aches, the pains, the anxiety, any of that go away, you really need to understand where it's coming from so that you can make changes in your life, or understand that you need to stay doing things in your life and not give up on it for the rest of your life so that they aren't ongoing issues. And functional medicine providers will help you with that. We are trained to do that. That is what we're out here trying to do, and not giving you a diagnosis and a prescription.
Yeah.
And I want to also add, if you're looking for a functional medicine doctor, integrative doctor, or any specialty, a primary care physician, doesn't matter. Find a physician with passion.
Yeah.
Find, I don't care how many letters are after the person's name or how they've been, they're at the top of the top. I want to see passion behind that.
Yeah.
That is so important.
It's so important and so difficult. It is
to
so
find.
difficult to find.
I think it's a process of, having these conversations, because you don't know, just like you were saying, it doesn't matter how many letters they have after their name or how long they've been practicing. Where is their passion and their compassion for their patients, But I like what you said about, prevalency doesn't mean it's normal.
And I want to piggyback on what you were saying about symptoms. It's so many of us, myself, I am the queen of this. I live with, okay, this doesn't hurt today. It hurt yesterday. It might hurt tomorrow. But you just go on. You just go on. You're not reading. And if anyone has listened to all of our podcasts and is playing the drinking game, we're going to say it again. Root cause, root cause, root cause, root cause. I mean, that has been the overarching theme of everyone we talk to.
Yeah. So the message is getting out there. We just need people to, to pay attention a little more.
Never stop asking why.
It's like, you're making me think. You're making me think. I've had this pain in my back I complain about it every day, but you're like, you just say to me, is like, why do I have this pain in my back?
Yeah.
And I swear we do not suffer from Tylenol deficiencies.
No,
absolutely not.
Yes.
Yeah, that's so true.
I was living on Benadryl for a long time, believe me.
Right. And the thing I love about where functional medicine and integrative medicine's turned, and what makes it so great is it is so open to all professions. My background's chiropractic. Chiropractors have been root cause, whole body approach for a long time. There's naturopathic doctors, medical doctors, DOs, acupuncturists, and thank God that we're now including all of these professions to help people, because that's what it's going to be able to do. It's going to be able to help more people when we, again, all work together.
Yeah.
Exactly.
If we could just change the healthcare system now
might be a little harder than now. I know it would be $1 billion hour. That's a whole other topic.
A whole other topic.
But ladies, thank you so much for being here and chatting with us. We really
great.
appreciate it. It was really great. And where can we find you guys? Why don't you say?
Well, go to our website, www.FMCNJ, stands for the Functional Medicine Center of New Jersey, Dr. Nicole Anderson and Dr. Kelly Blundy. And we have just loved being here. We love talking about this, as you very well know, and just being able to meet you both and having this opportunity. Thank you.
Thank you.
Yeah, our pleasure. Thank you so much. So there it is again, staring us in the face. Root cause, root cause, root cause.
Yeah.
Did you like my drinking game analogy?
I did like the analogy of that. That's so true. But yeah, but can't you just, you feel how passionate they are about it?
I mean, they really want to get, they're one of the few doctors that you talk to that they actually want to find out what that is. It's so hard.
It's so hard. And the amount of time, I just can't imagine. So their center is only open a few months.
The two of them.
Yeah. And it's just the two of them. And they're spending 3 hours.
3 hours or 5. I mean, as a patient, I don't want to be sitting there for 5 hours.
Oh my God.
It's so crazy.
But I don't know how they get through.
I know.
to see everyone. But
just how important like this whole kind of functional medicine movement is, and how important it is, and how,
Doctors
gone
need
are
to
the
get on
days.
board
I mean,
with it.
I talked about it like when we were cleaning out my dad's stuff and we found the list of medication. He was on 16 different medications.
Oh my God.
That, I mean, I didn't know about, but like, what were they doing?
What were they doing?
What were they
No,
doing?
they're yeah.
And
There's no
that you
quality
don't
of life.
necessarily, yes, I feel like learning what, just, I loved in the beginning how she was like, it's about being well. Living is about being well. It's not worrying about, we walk through life, like, especially like, we're recording this at the end of like winter and everyone around us is sick and people are wearing masks on the subways and things and everyone's afraid of getting sick, but they much more should be worried about how to stay well.
Staying well.
How to stay well.
Yep, absolutely.
You know?
No, I agree. I mean, it's what we're all about. Here.
Staying well.
Staying well.
Being well. Isn't that what I said in the trailer?
Oh my God. Yes.
How to be
well.
Well?
How to be well. We learned today,
how to be well. Yeah.
But no, they were great. Dr. Kelly and Dr. Nicole, and they're in New Jersey, but people can find, we didn't talk about this, but you can find functional medicine practitioners
wherever
at IFM.
you are. They're out there. I mean, we're lucky enough to be in a cosmopolitan area, and I think we've been to a couple of places. There's a place downtown, but they're out there. So go find them.
If you go to ifm.com.org, ifm.org.
What does that mean, IFM? Functional medicine?
Yeah, International Functional Medicine. You'll find them all over the country. So, sorry. But yeah.
Anyway, so we hope you enjoyed that as much as we did. I'm Lori Schulweis.
And I'm Jen Giamo.
This was Everybody Talks.
Talk to you next time. For more information about our podcast, to learn more about us, and to catch up on all of our episodes, go to our website at everybodytalkspodcast.com.
Follow us on Instagram at Shuli, at Jen Giamo, and at Everybody Talks. And if you want to watch today's episode, go to our YouTube channel at Everybody Talks Podcast.
Join the Everybody Talks community by checking out our Patreon page, where you can become an exclusive member of our wellness group and be a part of the conversation.
And don't forget, if you like what you've heard, give us a 5-star rating, write a review, and tell a friend. We're for everybody and everybody. The Everybody Talks podcast is co-created, executive produced, and hosted by us, Lori Schulweis and Jen Giamo. Produced and edited by Station 16.
Our theme song music is written and performed by Jackie Ryle and Aaron Navisi, with additional support from our pups, Oliver, Milo, and Murray.
Talk to you next time.